and soul belong to you. My world revolves around you, just me and you. You could be the one for me. You could be the one for me.
Hi, okay. Hope you guys can see me. Can you guys hear me? Okay, I can't hear any one of you. Just wait a second while we get all these things started. While we are having more people to join us on the Facebook live stream brought to you by Singapore Paincare Center as well as PFP Legacy. We're welcoming more people to join us right now. So slowly we're going to get the people to join us. So give us a few seconds. Thank you. Yes, a lot of people are coming in, just waving to all of you. So as we get more people to join us. Yep. Okay. Gotta get everybody. Hi, everyone.
Hi.
Hi, yes. Okay, we're gonna have a lot more people joining us right now. Okay, looking at the people joining us, all the Facebook participants, we see a lot of people joining us right now. So please give us a few seconds while we wait for more people to join. And do remember that you can also share this together with all your friends to join us at the Facebook Live brought to you by PFP Legacy as well as Singapore Paincare Holdings. All right, so before we start this, I think a lot of you have been working from home from a long period of time. First and foremost, let me introduce myself to you. My name is Charlene. Pleased to be the host for this entire webinar, proudly presented to you by Singapore Paincare Holdings, as well as the PFP Legacy. Okay, so joining us today, of course, we have quite a lot of a stellar cast of speakers. Before I introduce them to you, let me just share with you some housekeeping rules, okay? So first of all, you saw the Google form that's appended above our page. So you can fill up your name and your contact details so that later on when we have our live polling, our Q&A, when you comment, when you answer our questions, we will be able to notify you if we have chosen you as the winner itself, okay? So meaning that we will pick random people to win our NTUC vouchers. But first and foremost, we got to register as a participant. So here's how. Above this post itself, you see our Google form. Go ahead and fill up, taking this time to fill up because we have a lot more people joining us at the Facebook Live and a lot of people sending a wave to us as well. We're gonna wave back. Okay. All right, so these are the housekeeping things to be done while we wait for more people to join us. And staring in the face of the unprecedented economic shocks, working from home seems to be the new norm this day. And possibly this will be extended into the next phase 2 and phase 3. For how long you've been working from home? For me, I've been working from home for the past about 2 to 3 months already. And I would thought that pain has nothing to do with me, honestly. I would think that we are being young and if we work from home, it will not affect us. But I begin to see and I begin to realize that I have back pain. I think from the prolonged sitting and maybe from the incorrect posture while we work from home most of the time, we're being a lot more inactive and all this latency gives a lot of bodily pains to us. Okay, so that's why today our topic is working from home, a pain during COVID-19. And we are also going to talk about the pain of intestate in a few moments. And today we are really, really proud to have our stellar cast of doctors joining us for our talks. And just give you a highlight of who's going to begin first. All right. So first up, we have Dr. Mark Liu. Can you wave to us?
Hi everyone.
Yes, that's the Yen Tao Yang Lo Kun who is here with us for the very first session. Okay, he's going to talk about the back pain, all right? And our second doctor, Dr. Jeffrey Low.
Hi, everyone.
Yes, hi. Wow, bright and chirpy. Yep, Dr. Jeffrey Low will be speaking to us about the neck as well as shoulder pain because, when we use laptop, it's always this gesture and this posture. Mm-hmm. Okay, and our third speaker will be Dr. Bernard Lee.
Hello.
Hello. Yes, he will be speaking to us about the generalized pain and about the headaches. Okay. Yep. And finally, we have Mr. Willie Tan from PFP Legacy.
Hi, everybody. Hi.
Hi. He will be speaking to us about the pain of intestate. Okay. So let's kickstart this session right now, starting with our young Dr. Lo Kun for the very first session. Yeah. So Mark, maybe you can start sharing screen first.
Yes, yep. Sure. Will do.
Yep. So we're gonna have
quick click here. There we go.
Yeah. So while Mark is getting started on the PowerPoint and everything, we just want to share with all of you that you can now join us by, first of all, fill out the form above. And then the next thing that you could do for us is to fill out your name and then answer the questions. Take part in the commenting as well as the polling, and random winners will be picked from this pool of people to win the NTC vouchers. Okay, so Mark, let's go.
All right, thanks Charlene for the introduction. Happy to meet all of you. I'm very excited. This is my first webinar. I'm Dr. Mark. I've been practicing since 2011. A little bit of history. I graduated from Ireland, came right back here to Singapore to do my housemanship, spent 3 years in the public service, and I've subsequently moved on to private. My interest is in family medicine. I'm a family physician, currently training postgraduate in geriatrics and very soon to be in sports medicine. So I'm actually quite excited to talk about this topic that is very common indeed amongst most of my patients that I see on a daily basis. So let's start this rolling. So to prepare for this set of slides, in terms of managing back pain, I use the following resources. I would like to say that within Singapore Paincare Holdings, our pain doctors are trained in addition to the normal training that we receive in medical school. So we're a little bit, I would like to think that we're a little bit more precise in managing pain. All of these 5 resources here, I think the one that is I would highly recommend for the general public is Medscape. It's free, and all you need to do is start an account, email address, and password. And if you have any conditions you would like to read up on that has reliable sources, Medscape is definitely the one for you. Okay, so to just lay the ground for this talk of 15 minutes, I would be focusing mainly on the lower back because most back pain usually originates from that area. I will be also dealing specifically to adults who are 20 years and above. Younger patients with lower back pain or back pain in general tend to need a different approach. So in general, there are usually 5 questions that patients usually ask me when they have a back pain. And I can speak for most of our doctors when I say that I don't think there's probably a day that goes by without us seeing a patient with lower back pain in almost all our clinical sessions. It's a very common problem. And to some, it can be quite distressing. So the 5 questions that are commonly asked to me when a patient is dealing with a lower back pain are as follows. What causes it? Doctor, when should I be worried about it? Do I need an X-ray, an MRI, a CT scan? Is imaging useful? Doc, I don't want to get this pain anymore. Can I prevent it? Doc, what can I do? What are the treatment options available? So I'll be covering these 5 questions so that you guys, the public, can be very knowledgeable about managing your back pain.
Awesome. So let's kickstart.
Right. Okay. So the first things first, let's take a poll. What do you guys think? Roughly what percentage of adults in the last 3 months have reported a lower back pain symptom? Is it A? Yep.
So this is since the COVID period, right? So last 3 months. So if you think the answer should be A, 10%, just type A under the comment section. Or is it B, 50%? Or is it C, 70%? Or do you think it is D, about 90% of the population of adults in Singapore has been reported to suffer from back pain symptoms for the last 3 months? Put your comments down below at our Facebook page itself. Wow, I see a lot of you say 90%. Wow. That's really serious, right? I mean, I read a Straits Times report and also on Bloomberg News, there's increasing number of people suffering from pain problems and potentially escalating into chronic pain problems during this COVID period. So now the question is, what do you think it is? Like, is it 10%, 50%, 70%, or 90% of the adults working from home has been reporting back pain symptoms for the last 3 months? We see a lot of C's as well. So C is 70%. A lot more C. I would say about 70% of people say C. And we have about 20% that says 50%. Okay. And the people who chose C is still increasing. And initially it was 90% was leading the pack. Okay.
Right.
But do not be swayed by what I say. Okay? I have no idea how many percent. I would also guess it's C, but I'm not sure. So I guess it is time for Mark to unveil the results of this tourist.
So I've based on the 5 resources that I scanned through while preparing for this set of slides, the answer is generally closer to C, but it wouldn't be a far cry to say C and D. The number would definitely be around C to D. That's how common back pain problems are. As I've said, every general practitioner out there on a daily basis would not fail to see one case of a lower back pain. So this is a very common symptom indeed. Okay, and as Charlene has rightly pointed out, in general, back pain to all doctors is classified into acute or chronic. Acute pain is where we see what most of our patients have. They have pain which has started for less than 4 weeks, and doctors tend to get a little bit more worried if a patient reports pain that has been lasting for over 3 months, whether the pain is ongoing or intermittently coming and going. So that would be classified under chronic back pain. So acute and chronic back pain is an important classification when we're dealing with pain in the back. So as I said earlier, it is a very common problem. But the good news is that as it is a common problem, majority of patients with back pain, it usually resolves on its own. Out of 100 patients with back pain, about 90 of them would be musculoskeletal related. They would require treatment options which are conservative mostly, and they will recover on their own. 5 to 10 of them may require a bit more investigation, maybe imaging, maybe escalation of treatment. And out of the 100 patients that see me, I may get one patient which needs immediate attention, maybe a referral straight away to the accident emergency for an emergency scan, maybe into the hands of an operating theater for emergency decompression, for example. So if you were to Google what causes back pain or lower back pain, you will find there are a myriad of causes. However, like I've said before, 70% of all back pain symptoms are caused by musculoskeletal injuries, a strain or a sprain, a herniated disc, for example. More sinister causes, and this should be elicited by the doctor during the history taking, would be a history of an injury or a fall, a very blunt force trauma of a high velocity. There are other more sinister causes such as infection. So back pain, sudden onset of back pain with fever is a little bit of a concern. If the patient has had recent surgery or treatment for surgery, a back pain without any obvious cause might indicate possible metastasis, but these are rare, though not very common. Of course, in the elderly people, the 70 to 90-year-olds, when I hear back pain, I'm thinking, is it a possible degenerative cause, wear and tear, osteoarthritis related? And finally, systemic causes, things like an inflammatory disease such as rheumatoid arthritis can cause lower back pain as well. Okay, so this slide is really one of the more important slides in this presentation. When should you be worried? Now, as general practitioners, we're always on the lookout for red flags. So in every symptom, we normally screen whether the patient has any red flags. So these are the symptoms that you should be concerned, and definitely seek a doctor's opinion. Definitely see a doctor's consult if you have any of these symptoms. For example, back pain with nerve related symptoms such as, I have numbness in my lower legs, weakness in my lower legs. I can't control my urine. I can't control my bladder. These would be red flags. Back pain, which is excruciating pain, waking you up at night, is a concern. Back pain with fever. And as I mentioned earlier, if you've had a recent treatment for surgery like breast, prostate, lung, and you've suddenly experienced back pain for no apparent reason, you should definitely seek a doctor's consult as well. Another case of lower back pain that's famous is the loin to groin pain that is taught in medical school. When a patient complains of pain in his lower back that radiates to the front, especially when he's urinating, that it may indicate kidney stones. And that is normally a very painful and needs to be treated quite immediately. Okay, second question. I think this question, if you've been paying attention to what I've been said so far in the last 5 minutes, you should get this right. How many % of patients who have back pain actually require imaging?
Oh, imaging as in all these CT scans or X-rays?
MRIs, X-rays, yeah.
Okay, so if you think that it is 10%, that is A, could you please comment on the chat box below? Just say A. If you think it's 50%, please type B. If you think it's 70%, please type C. And if you think it's 90%, please type D. Let us hear your views on this question. How many % of the patients who suffer from the lower back pain requires imaging of sorts like CT scan, MRI? So type your answers so that we can see your response. It's time to hear from you. Test time. Okay, real quick quiz time, just to make sure that you guys really know what you are, listening and also learning from. And also by commenting and by polling and by also answering to the question, you stand a chance to win our NTUC vouchers. 10 random lucky winners will be picked at the end of this session. And for you to win this, you got to really comment below. Okay, is it A, B, C, or D? I see a lot of people has a lot of answers that is very varied. Okay, I would say that there is a lot more A's over here. I would see 30% of A answers here. And I would see a 30% of the 70% C over here as well. Another about 20% would say D. Okay, and seems very varied. A lot of C's, a lot of A's, a lot of B's. Nobody seems to know the true answers to this. There is very wide disparity of the answers. Okay, so let's see. Callie says A, Shirley says B, and Hok Kwan says A. A lot more says A. Charlene, and then we have Wendy says B. Nancy says B, and we have Eileen Chong who says C. A lot of A and C's over here. It's either 10% or 70%. Please tell us that we are right.
Well, one of them is definitely correct. So actually, if you take the entire population of patients who have lower back pain at any one point in time and ask the question, how many of them actually need imaging? The answer would actually be A, 10%. So it's a comforting fact to know, because it means that most people who have lower back pain, they're not in a state where imaging is required. So I get this a lot as a doctor. I get patients coming in with a very excruciating back pain, and after I do a thorough history and examination, the patient asks me, "Doc, do I need to go for an X-ray? Do I need to go for a CT scan or MRI?" I would always caution them to say that, we usually want to try conservative methods first, treatment with some medication, with some physiotherapy, before we don't want to jump the gun and order expensive investigations, because they've done studies that show that when you image a person's back, many times abnormality may be found, even if the person is not actually having any symptoms. So we could be over-investigating. And worse is, sometimes treatment of the abnormality found on the scan itself may not actually produce the intended resolution of symptoms that the patient is actually seeking for. So this slide is just thrown in to actually get the public to be aware that, it's not always about getting the top grade high resolution imaging scans. It doesn't take away the good old fashioned history and examination, and so we shouldn't jump the gun to order expensive imaging. So this slide again just re-emphasizes the point that imaging is not the solution to the problem. And in fact, if improper clinical correlation is done, then your treatment effect may not be as good. Okay, most important slide in the whole presentation. How can I prevent lower back pain? Or what do I do if I have lower back pain and I want to recover faster? So it's amazing, but the little things really do matter. The most important is to be aware of your back and your posture throughout the whole day. Now, in COVID-19, where everybody's working from home, it's fair to say that we're sitting down for a lot longer than usual, and this puts a lot of pressure on our lower backs. So some ways to alleviate the pressure would be to put your feet up on a stool. If you're standing for long periods, like those who are involved in sales, they could make some time to maybe rest one foot on a stool or a pedestal. Certainly, your work environment really matters. So try your best to use a desktop at an eye level, and keep your shoulders at resting, not elevated like this to type a keyboard. Laptops are not great for this. So connect your laptop to a monitor, have an eye level view, and keep your back straight. These are the sort of small things that you can do to really alleviate lower back pain. When you're sleeping, if you have lower back pain, some ways to alleviate the pressure would be to put a pillow between your knees. If you're a side sleeper, if you're a back sleeper, you put your pillow between underneath your knees to alleviate the pain on your back. This trick really works. I've done it myself. When you're lifting heavy loads, definitely use the forklift method. Do not bend your back and lift up the object. This is especially true for parents with young children. when you're picking them up from the pram, always try to bend your knees and pick them up, or so that you won't sprain your lower back. And always exercise as much as you can. I've always stressed to my patients that exercise is the best form of medicine. I know that our movements are restricted during this period, but doesn't excuse us from doing some maybe some high intensity aerobics at home, or maybe just going downstairs and doing a brisk walk or jog. So these are the small things that are really important for prevention of lower back pain and ensuring a better, faster recovery. Some things that you can do when you're having a lower back strain is to stretch. I particularly like this slide because it gives a few simple exercises you can do to maintain flexibility and condition your lower back muscles to prevent further injuries. The one on the top left, standing hamstring stretch, is very easy to do, and it really does stretch your lower hamstring muscles and helps to alleviate pressure off your lower back. I'm throwing in this slide because I think that anyone that has a lower back pain, it could be a reminder to actually maybe it's time to maybe do a health screen checkup, just to see whether there's any early problems that can be detected and solved. For the elderly, looking at your calcium and vitamin D levels is important. It helps to prevent fractures, and tells you whether you need to take supplements or not. Okay, and this is something that a lot of patients of mine also complain of. They want immediate, fast results. And in general, yes, we can give medication to help produce that instant, to produce a fast recovery. However, full recovery should take about 1 to 2 weeks. 50% of patients usually recover within 2 weeks, and 90% of patients actually recover within a month. So if it's a chronic lower back pain, then it's important to discover the cause of it. And once the cause is found and treated correctly, then resolution of the back pain will occur. Okay, so the next question, what sort of treatments are out there, doc? How can what are you going to give me? Well, if it's an acute back strain, as a majority of our patients, the good old Panadol added on with some non-steroidal anti-inflammatory drugs such as diclofenac, Arcoxia, Synflex. These will have synergistic effects and will actually alleviate the symptom of pain. More serious pain, if it's indicated, we would give an injection, and we would advise the public to advise my patients to put ice and rest. Okay, if you have chronic back pain, the treatment options are slightly different, the medications are slightly different. And for us doctors at Singapore Paincare Holdings, we would usually give a course of pain medications for a longer period of time and slowly wean them off these pain medications. I believe Dr. Jeffrey and Dr. Bernard will elaborate more on this in their slides.
Thank you. Okay, so just now we mentioned about a lot of the symptoms that we see when we have back pain and all. So we also spoke about the treatments and the imaging that we are supposed to get it done once we have established the fact that it is serious enough for us to get the imaging. Okay, yeah. So right now, I think we have to go to the next topic, which is on the neck pain. So we're gonna just get the doctor who's going to be next up is Dr. Jeffrey Low to join us. Okay, so Jeffrey, yes.
Hi, everyone.
Yes, while we get the slides for you to come on, we are going to speak about the neck pain and shoulder pain, which is also a very common pain in Singapore because a lot of us are desk bound most of the time, and unknowingly we tend to do this all the time. So there's a lot of strains. It creates all these knots around the shoulder, and no matter how many massages that we go, we could feel instantly better on the day that we go for massage, but the effect doesn't last for more than 2 days. So this is an ongoing problem for all our workers and staff in Singapore. Can you share with us more about neck pain and shoulder pain, please?
Sure, Lynn. Thanks, everyone. Thanks for joining us in this lecture, small little topic on neck and shoulder pain. And as you've heard before, Dr. Mark was speaking on back pain, and today I'll be covering shoulder as well as neck pain. So first, we'll go to the neck pain. Okay, so basically there are three different kinds of pain generators for all sorts of pain, be it back, neck, shoulder. We have mechanical pain. Mechanical means it's something that's pressing on it, whether it's a nerve impingement, whether it's a disc problem, or whether it could be a sprain from a tear or something. The second one would be neuropathic pain, right? It's very common. Let's say if you have nerves hypersensitivity, and then or certain conditions such as zoster, shingles. In fact, it's shingles infection when the nerve is affected and hypersensitivity. This is what we classify as neuropathic pain. The third one is usually caused by muscle spasm, and we call it functional pain. So basically, there's spasm around the neck areas when you're suffering from back pain for a long time, neck pain for a long time. The muscles will become stiff, and that's why, as Shirlene mentioned before, you go for therapy or spa or certain massages, it gets better. Yeah, of course, for 1 day or two, and after that, the pain comes back. So we want to, treat the root of go to the root of the problem in order to treat the pain. Okay. So neck pain. All right. So of course, besides the neck and the shoulder, we have what we call referred pain. So sometimes referred pain means the area of the pain is not at the source. Sometimes you're having neck pain, but not only do you have neck pain, you also have shoulder pain as well. So sometimes the shoulder pain can be related to the neck because it's it's run by a network of interconnected sensory nerves. So instead of feeling pain at the source, the pain signals will travel to the surrounding areas, sometimes to the shoulder, sometimes to the front, to the chest. So it's very important for the doctor to determine whether the pain is due to the neck or whether there's pain elsewhere, such as shoulder. Okay. So these are what we call pain dermatomes. So you can see C basically means cervical nerves, C5, 3, 4, 5, 6, 7, 2 all the way to 7. You can see the areas of coverage. All right. So sometimes when you have a disc prolapse at the neck area and the let's say C2 area, you may also have neck pain not just in the midline, but also near the ear, nearing the shoulder. So it's very important to differentiate between the different dermatomes and what we call referred pain, whether it's due to the neck or whether you really have a true shoulder problem. Okay, so we will poll the audience, right? So if you've been listening, how many kinds of pain generators are there? Is it A, 1? Is it B, 2?
Is it C, 3, or is it the D, that is 4? Okay, so how many kind of pain generators are there? So Jeffrey, when you talk about pain generators, what do you mean? It seems like a very cheap term to us. What do you classify as pain generators?
Well, the pain generators, as I mentioned in the first slide, actually. Yeah, so like let's say if you're cut by a knife, the pain generator is a mechanical source, right? Whereas certain sorts of pain are from a nerve perspective. Let's say a facial pain with a trigeminal neuralgia, or whether it's a herpes zoster infection. Of course, the third one would be more of a functional pain where it's a muscle spasm. Yeah.
Okay, I see that we have about 90% of our polls here that says C. So Jane, Li Wei, David, Desmond, Deborah, Boon Ling, they're all saying C, 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 C. Nobody has chosen D. Nobody at all.
Well, and you're right.
And I guess they're all right?
Yes, that's right. Okay, the answer is C. Okay, why is it very important to determine what the pain generators are? Because the way we treat the different sorts of pain, we use different modalities, different kinds of treatment, and the painkillers and the drugs and the medications are totally different for all three different types. So it's very important to differentiate between what kinds of pain generator is it. Otherwise, For all sorts of pain, you just give Panadol, you just give painkillers, you just give aspirin and stuff like that. Patient will not get better, and that's why a lot of patients complain that they've seen this doctor, that doctor, and so, and they're still not getting better. All right. So what's the pathology of pain? All right. So this is the spinal cord with the spine, right? So if you look at the picture on the right, you can see the spinal cord. This is where the nerve is, and the nerve roots coming out of it, and then you have the bone. All right. And in between the two bones, what we call the vertebra, you have the disc. This is like a soft bone sort of cushioning between the two, so to allow flexibility of your neck, of your back. All right. So when you look at the spine pathology, you have to determine whether it is a bone problem, whether it's a disc problem, such as a slip disc, whether it's a nerve compression, is a nerve problem, or whether it's a joint. So in between the two bones, there will be small little bones, joining, attached to each other. So sometimes there could be inflamed joints, or sometimes it can be some arthritis of the joint due to old age. Okay, so prolapsed disc. So if you look at the soft bone between the two vertebrae, what we call the disc, all right, so sometimes certain sprains or certain posture or certain movement may cause the contents of the disc to come out and impinge on the nerve, and that's where you get nerve impingement, or what we call prolapse or slip disc, as the public commonly recognize this. Okay, so some of the other non-spinal pathology. So besides the bone, we have the ligaments, we have the muscles that are surrounding the bone. So sometimes when the patient is in pain, the muscle will go into spasm and to stiffness, and you can't move the back as flexible as previously. Okay, just to show you what very bad neck looks like. On the left, you can see, if the bone is nice, the shape should be regular, rectangular, but then you can see the shape is like all over, and then you have small little bones jutting out of the vertebrae. Yeah.
Yeah, this is very real. Yeah. So let's have a look at how this X-ray is. But sometimes, when we look at X-ray, we have no idea what symptoms these are. So it's always best to speak to the pain doctors or the pain specialists. So we're including a lot of live examples and live cases so that you guys can have an understanding of the case study and what could possibly happen to you when you don't have the right posture while you work.
Yes. All right, so you can see the normal spinal cord. And if you look below, there's some bulging disc. This is from an MRI of a patient. Yeah, sometimes when small little bulges sometimes may not cause pain, but if it's more significant, like let's say there's 50% stenosis of the spine, then you might have numbness of the fingers, numbness of the shoulder, and pain shooting down from the neck all the way to the shoulder. So the pathology is actually in the neck, but you feel as if it's on the fingers, it's in the shoulder. Yep. Okay, so functional neck pain, the third neck pain that we are talking about, it's no obvious cause sometimes. You just have pain all over. I think if you speak to your grannies or whatever, they will just say, long zhong tia. They have pain all over, from the neck, from the back, from the shoulder. So sometimes it's difficult to point out the particular pathology, but they may complain of severe stiffness and maybe a lot of external triggers. Sometimes can be stress, sometimes can be lack of sleep, causing this. And of course, we can treat this sort of pain as well. But after treatment, sometimes they may need long-term medications. Yep. Okay, so what kind of treatment options do we have? All right, we have the first one will be conservative. So conservative will be your spa, your physio, your chiropractor, exercise and medication. So if it's for acute pain, right, pain that's lasting less than a week or 1 or 2 weeks, sometimes with all these modalities, patient recovers. But if the pain persists, usually lasting 6 weeks, 8 weeks, sometimes we may need surgical treatment, or alternatively, we can have a minimally invasive non-surgical intervention. Yeah. So we treat, if it's a spinal problem, we treat the spinal cause of it. If it's a disc problem, sometimes, when there's a disc prolapse, you just suck out the disc, you free the nerve, and you desensitize the painful nerve, and of course, the patient gets better.
So this is actually a minimally invasive surgery.
Invasive.
So you do
Yes.
not need open wound, open
Yeah.
surgery. Yeah.
Correct.
So we have an option.
Yes, in fact, most patients can recover well with minimally invasive surgery because it tends to preserve the architecture of the bone. All right, we don't do anything drastic. You just go through a small hole beside the neck, and then to just suck out the disc, and that's it. You solve the problem rather than having some big operation, and then you have to you need anesthesia and stuff like this, and sometimes it can cause more problems if you destroy the architecture of the. And of course, there are more risk as well, especially.
Yeah, it sounds like great news to us because a lot of us might just think that, once we have pain and it's really bad, it's chronic pain, we need to have open surgery. And then that's why a lot of people don't choose to see doctors or specialists when they have a problem because all are afraid to go under the knife. But now the medicine has advanced so much, as well as the treatment modality has advanced so much that we just need a minimally invasive surgery, just like what you said, just a pinhole, you suck out and create a vacuum, and then you collapse it back. It's just a pinhole, and the scar is also really tiny as well. So these are little options that we could opt for. Good news for us. Thank you.
Yes, of course. And Dr. Berner is an expert in this actually, and I believe he'll be talking a lot more about this minimally invasive procedures. Yeah. Okay, so we treat the symptoms. We treat, I think we've mentioned this before, physiotherapy, and also medications. And of course, pain injections. Maybe you go on to the next slide. Yeah, this is what GPs or family physicians can do. What we do is we go to the pressure, the pain points around the neck, and you can see the upper back, and sometimes it goes down to the shoulder as well. So we go to the places where it's most painful and where it's most inflamed. We can do local injections over these areas, and of course it takes away about 70 to 90% of the pain. And of course we are talking about permanent solution to treating pain. Yeah. Okay, and of course exercise helps with pain. In fact, when after we have treated the patient, we always encourage the patients to exercise, because by not moving your muscles, you actually get more stiffness. So it's a paradox here. So once you're pain-free, we encourage within 1 or 2 days to encourage the patients to exercise, unless of course if the patient has fracture, that's a totally different issue. Yeah. Okay, of course you have braces, you have neck traction, you have all these things to help with the pain. And of course medications. Yes, and medications are important because it's important to differentiate between I mentioned before, the 3 different sorts of pain. If it's a mechanical pain, like you're cut by a knife, you use aspirin or anti-inflammatory or Panadol, it will help with the pain. But it's a nerve problem, let's say zoster, herpes zoster, or shingles. If you take a painkiller, sometimes it may not work because it's a nerve. You need to target the source, which is the nerve. And if it's a functional pain like fibromyalgia, taking Panadol, and even nerve medications, it may not help as well. So it's very important in the physician's mind to differentiate between the different kinds of pain. Yeah. Okay, shoulder pain. Wow.
I think all of us have shoulder pain.
Okay, how do issues with shoulder pain? Okay, lack of understanding of the etiology. Yeah, as I mentioned before, whether there's really a true shoulder pain or whether the pain is coming from the neck. Okay, so this is the normal anatomy of the shoulder. You have the muscle surrounding it, you have the bone, you have the ligaments. All right. Okay, so you need to differentiate between that means inside the joint, or is it outside the joint? So if it's inside the joint, we think about gout, osteoarthritis due to old age, or rheumatoid arthritis. If it's outside, which is more common actually, rotator cuff tendonitis, impingement syndrome, which is due to inflammation of the tendons as well as the muscles. Yep. Okay, and of course, we have acute, you have a chronic shoulder pain, acute less than 2 weeks, chronic anything more than 4 weeks or so. Yeah,
Actually, this is a definition that the
very
very first time
arbitrary.
yeah, I
Very
heard
arbitrary.
like 4 weeks is considered chronic, and I would thought that months or years is considered chronic. So yeah,
Yeah.
anything that's more than 4 weeks is considered chronic.
It's just a gauge lah, so that we know when it's a chronic pain. Actually, we do treat it differently because the medications we use should be something different as well. Yeah. Okay. Okay, so this is the rotator cuff anatomy. You can see the 4 different muscles and tendons that are attached to it. All right. Next. Okay. So the pain, this is very common, rotator cuff pathology, tendonitis, bursitis, and impingement. If you look at the diagram below, you can see between the joint, right, there's a muscle and a tendon there, and you see the blue pouch there. It's basically a cushion, and it's very common, because the cushion allows you to move your joints smoothly. So anytime when there's inflammation of the bursa, as what we call, it will cause inflammation and it'll cause stiffness and pain, especially when you move the shoulder. Yeah. Okay, impingement syndrome. Maybe we'll skip this slide. All right. So just to show you the different kind of impingement syndrome. There are a lot of very technical terms, but it's more important for physicians. So I'll just like to show you the picture. If you look at the diagram, you can see the muscle. Yep. And this where this one, the muscle, the tendon, the bursa. All right. So all these problems, can cause shoulder pain. Okay, next. All right. So what we do is we target. If it's a bursa problem and we know it's an impingement problem, we do injections into these areas, right? We should help with the pain tremendously. Now, of course, you have rotator cuff, tendonitis. You have bursa inflammation. Rotator cuff injections, the same as well. Next. All right. You have a AC joint arthritis or inflammation. The same thing as well. As GPs, once we can find the cause of it, we can treat it. Yeah. Okay, so you look for the most tender point, you determine where the bone is and where the space is, and you inject directly into it. Yeah. Okay.
Time. Okay, well, doctor takes a little a short breather from here. Let us just poll the audience. Once again, here's your chance to win the NTUC vouchers if you were to answer them. Which of these do not form part of the shoulder? Is it what Dr. Jeffrey Lowe has mentioned? Is it A, bursa? Is it B, disc? Is it C, muscle or tendon? Or is it D, bone? So let us see your answers in the comment section below. And let's see. And we also have questions coming in right now. I know a lot of people are asking questions. We will take some time to go through your questions together with the doctors, okay? So meanwhile, for the audience, a lot was saying C, and C, which is the muscle and tendon. And let's see how many of you says B. We have Els that says B. Albert says B, which is the disc itself. Okay. So do remember that when you type in the questions, answers on the comment section, you must remember to press the like button on our Facebook page. Okay, like button first, and then you'll go ahead and answer. And for those of you who have just joined us for our webinar, you have yet to actually register. You can register on the form, Google form above. Okay, all right. So there's a lot of about 70% that says B over here, which is a disc, and we have about another 30% that says muscles and tendon, but C. So the answer is B.
Yeah, the disc is found in the spine, which is the bone. So it's the neck or the back. Yeah. Okay.
Let's quickly move on to
let's quickly move on to frozen shoulder. So underlying cause sometimes is insidious and we don't really know the exact cause. Some people just have stiffness of the shoulder for no apparent reason. Sometimes after a major surgery, they may get stiffness. All right, so it's more commonly found in age 50 and then menopause. So you have basically pain around the shoulder, and very simple. Most of the time they just can't move the shoulder at all, whether it's up, down, left, or right. So and the stiffness and the pain, it can last for many, many months, and it takes a very long time for them to recover. Resolution of pain, if you look at the slide in stage 2, it takes 6 to 12 months to recover. And of course, I think most people would not want to suffer such a long time, for them to recover. All right, so mobilization of the joint is very important. Okay, I think that's all I have for the shoulder and the neck. All right, so basically to mobilize, to go for physio, and of course, certain injections can help with the shoulder pathology, frozen shoulder. So after the injections, once there's less pain, you need to get the patient to move the shoulder, to exercise, to do physio. All right, so as to improve the mobility. Yeah. Okay, that's it.
Okay, thank you, doctor. Okay,
Thank
we
you.
see quite a lot of questions. Maybe we'll just quickly go through some of the questions first while we let Dr. Lee load out his slide for the next one. Okay, so there are some questions here that they ask, injection of Botox can help?
Well, I'm not very familiar with that. Maybe I should get Dr. Lee to answer answer this. Yeah.
This is a little weird, like Botox, maybe not, huh? But we will.
No. There are many uses for Botox actually.
I
So
see.
I think Dr. Lee will be the best person to answer that question. Yeah.
Okay, so what is the difference between the mechanical pain and also the functional pain?
Okay, it's the way we doctors define it, because the treatment is totally different. When we say mechanical pain, we mean things like aches, sprain. There's a cause to it, or let's say you're cut by a knife. It's a mechanical, something causing it, or you got burnt by a fire or scalded by hot soup. This is what we mean by mechanical pain. Whereas functional pain is it's like a basket term, where we can't find any cause of it, and there's a lot of stiffness and muscle spasm around the spine areas, around the shoulder area, and this is what we call functional pain. And the most classic example in medical school teaching is fibromyalgia. Yep.
Thank you, Dr. Jeffrey Lowe, for sharing with us more on the neck pain and shoulder pain. We'll have you back later for the panel Q&A. And
Sure.
here we have Dr. Bernard Lee here with us, and he's going to share with us more about the generalized pain. That sounds like a 龙种条 that he mentioned earlier on, and also about headaches.
Yep.
So, Dr. Lee, are you ready?
Thank you. Yes, I'm all ready. Let's go. Well, everyone is now working from home. You got to stay at home. The usual routine of going to work, going out, being out about, that actually has significant impact to everyone. Actually, the impact is quite serious. Many people don't realize it. It actually results in the loss of movement, the activities. When you have all this loss of movement and activities, it results in what we call it loses or reduced muscle activation and utilization. And don't underestimate our muscles. It's actually a very important thing. The moment we stop moving our muscles, the moment we stop doing things, simple thing like just walking out of the house, taking a bus, going to the market, the moment we stop doing all that, this becomes no exercise. Or take it to the extreme. When you're staying at home, it becomes like what we call a sedentary behavior. You become a couch potato. You watch the TV at long duration period of time. And there are lots of studies to suggest that not even taking the point about no exercise, just talking about sedentary behavior, whereby you just sit for an extended period of time watching Netflix, watching your favorite videos, hours and hours, chasing after the Korean drama, etc. That itself, lack of exercise or prolonged sitting, can increase a lot of different conditions. It can cause diabetes, cancer, obesity, cardiac heart problems. And hence our Ministry of Health, our Public Health Promotion Board, came about with the need to have this 10,000 steps daily challenge. When I first heard it, I thought, wow, that was an incredible so-called initiative by the government, because that in itself incentivized everyone to try to have an active lifestyle, to reduce this problem of sedentary behavior, so that you do not get into a situation of disuse syndrome. So this disuse syndrome What is that about? This disuse syndrome results in what we call muscle atrophy. Big word. What it means is that your muscles shrink, your muscles get wasted. Take an example. If you put your arm against your body, even though you have no injury, you just put it there and you hold it in place for about 6 weeks. Don't move it because you voluntarily not moving it. You'll find that there's wasting, there's atrophy, muscles will shrink and muscles will get stiff and tight. So that in itself is, imagine if your body doesn't move, you just watch TV hours and hours, you just vegged out, you don't do anything, that can cause serious significant side effects. There'll be cardiovascular effects such as what we call high blood pressure. You can have what we call reduced blood volume, means that the amount of blood that's pushing to the rest of the body, almost like saying 血液不循环, like the blood circulation is reduced by 10 to 15%. Not forgetting that there are other effects such as the central nervous system. Just by us not moving, physically inactive, that's got what we call mental issues. When we talk about nervous system, we talk about the peripheral nerves, we talk about the central nerves. Central nerves is the brain. Yeah, you will find that you think slower, you have memory problems, you have got depression, even anxiety. So actually during this period of time, my colleagues next door, the psychologist and the psychiatrist, very busy, extremely busy. Yeah. At first we thought they shouldn't be essential, but yet they are essential. During this period of time, they're essential services. They have to remain open. Disuse syndrome and pain. There's a very, very good correlation to this whole thing. The maxim says, use it or lose it. True. If you don't use it, you will lose it. And when you lose it, you'll cry over it. That one I added in. In disuse syndrome, the muscles, the skeletal muscles will lose its mass. It will get what we call atrophy. 纠罪. And then when it's 纠罪, then there's not enough strength. When there's not enough strength, you'll find that a simple movement just by sitting for a longer period of time, pain. Or just by trying to get up from the chair, why is it painful? Just by bending over is painful. Just by the sheer fact that the muscle has lost its strength, atrophy.
I guess we are all victims of it. I guess I'm feeling all these things that really applies to me. I think a lot of people are working from home, and I think the furthest we ever go is maybe go kitchen and get some water and then back to working, and then after that we're just walking from bedroom to the next bedroom to the kitchen to the dining room, and these are pretty much wasting of our muscles because we don't do a lot of active things. We used to maybe go out for lunch in the office just walking out from the office to the hawker center or food court. That is a bit of activity, but nowadays working from home has this allow us the use of all this physical all these muscles from this physical activity. So I think that's why it will cause mental pain and also physical pain as well. Yeah, right, doctor.
Thank you, Dr. Charlene. Well said. So I'll push on in the interest of time. So muscle inactivity and pain, if you push it even further, if this COVID shut down, we're going to push it all the way to 6 months to a year. They found that, by inactivity, you actually can result in what we call osteoporosis. Your bones become brittle. You can actually fracture easily. And we do know, interestingly, that lack of activity, interestingly, have got an effect on the disc height, the spine, the disc height. It's quite contrary to what we would have expected, right? We would expect more exercise will cause flattening of the disc height, but here we are saying that lack of physical exercise, lack of physical activities will cause reduced or narrowing disc height. And that in itself can cause more back problem. So this disuse syndrome, if you can follow me. So one moment you have got pain, right, on this part here. And then this pain will result in disability, and then you think this pain is very bad. Therefore, you don't dare to move, and therefore you're going to sit more and lie down more, and that results in what we call muscle wasting and deconditioning, and it perpetuates your pain again. So this cycle continues to mediate and maintain itself until you understand what's going on. So that's why I always say, recognize and understand what this pain is, rather than saying all pain, we need to sayang, all pain, we need to rest. But we need to understand what is the pain that is coming from, what is it coming from. So when you have got muscle atrophy, you will see that the muscles here at the bottom of the back, at the top part of the shoulders, at the back of the head, you will find all these muscles can have atrophy. You look at this MRI, this big muscle block. Hey, when this muscle block is wasted, is atrophied, you will have a lot of weakness. So just doing a simple activity just by moving your neck, getting up, will have lots of pain. And this is a very, very good graph, which I always like to share with my patients. We don't want to be at the either extreme of the two ends of this U-shaped curve. Too much activity, extreme, you're going to get more pain, not just back, everywhere. Too little activity, on the other hand, you also will get increased pain. So we want to be within this bell-shaped, inverted bell around here, in the middle. So it's quite important to have what we call a regular amount of activity. The 10,000 step challenge is great. I always say to my patient, please, even during COVID, you should maintain a certain amount of exercise. Next, headache. Whenever we talk about headache, we must always understand what this pain is coming from. To the doctor, the headache, we always want to exclude what is sinister. What kind of headaches we need to be wary about? Things like a stroke, things like a bleed, things like, tumors. So these kind of headaches, we call them secondary headaches, are very sinister. So not everyone's headache is the same. The type of headaches that we are not so worried about, that is quite distressing, similar like a stroke headache, is what we call a tension headache. So a tension headache, if I can use Joe as an example. Here, Joe has a headache, and he will say that his headache is around here and at the back. It feels like a clamp, and it feels like a pressure at the back of the head.
Can you lift it up higher, because we saw it halfway? Yeah.
The clamp behind, the front, and at the back, throbbing. What we are worried about is what is inside the head. We're worried about strokes and all that. So if your headache persists and your headache doesn't go away and is troubling you enough for more than 6 weeks, I would say please get someone or get a medical attention to exclude the possibility of those things that we were talking about, sinister. Symptoms of tension headaches: pressure, dull, feels painful when you press it. You can have poor concentration, you have poor sleep, you have low energy. Tension headaches, while it's very common, is very difficult to exclude or to differentiate from other kinds of headaches. Everyone come and tell me that they have got migraine headaches. This makes migraine headaches even more common by nomenclature, but actual fact, tension headache is by far more common than a migraine headaches. To put it simply, migraine headaches is a vascular headaches, tension headache is a muscle kind of headaches. Difficult to differentiate from the two.
So we can't differentiate?
From the patient's perspective, you guys can't. You need people like us. We got to help you, we got to examine, we got to take a proper history. Most tension headaches are not associated with visual problems. They don't get those flashy eyes things. They don't get those color blinking things. They may or may not get nausea. Sometimes, most of the time, they usually don't. Physical activities can make a migraine worse, but not a tension headache. And sounds and lights glaring when you go out to the sun, when it's bright lights, the migraine sufferer will always say, I need to hide into a dark room. Tension headache, less likely, but still can happen. What are the causes of this kind of tension headaches, which is a very common, what we call muscular headaches? Stress. The very fact that we are working at home, COVID time, you'll be interested to know that you actually work doubly harder at home than you're in office. When you're in office, you can Skype in your own little cubicle and nobody knows about what's happening. When you're at home, your boss will be chasing after you with emails and then, hey, why are you not answering your emails? It's already been 15 minutes. I sent it to you last. So a lot of stress. Eye stress, mental stress, emotion stress can cause these headaches. Lack of exercise, poor sleep, and increased sensitivity to pain. No time to go into this, but for tension headaches, simple answer, if you can manage your stress, that will be very good. Different kinds of stress management, maybe offline, I can share these with the rest of you. When we address a tension headache, when you can't manage it on your own, how does the doctor help you? We will try to go through these different spectrums. We have got painkillers. Doc, I don't want to take painkillers. Painkillers are bad for me. If you take it short term, not so worrying. Of course, doc, if you have to take it long term, like a migraine or even sometimes tension headaches, we have to discuss with the patients to talk about what we call the endpoint. We weigh the pros and the cons, the risk-benefit ratio. There are many different kinds of pain medicine, not just the standard kind of painkillers whereby when you break your bones, you take an anti-inflammatory. There are things like muscle relaxants, anticonvulsants, antidepressants, and injections. When we talk about injections, there are many different things. You can inject different areas. No time to go into that. So let me poll the audience. Charlene, you could help.
Okay, so time to get busy right now because activity is really good for us. Okay, so tension headache, which is more common than migraine, has most of the symptoms except, is it A, tightness, clamp-like headache? Is it B, visual disturbance such as blurring, color changes, or double vision? Or is it C, poor concentration, fatigue? Or do you think it is D, poor sleep and low energy? So give us your answer in our comment section. In fact, just now, Dr. Lee mentioned about the difference between tension headache and also a migraine. So now, tension headache, I think it's more common because from the looks of what Dr. Lee have just mentioned, I think I suffer tension headache before, like guilty as charged. So I think a lot of people also tend to work a lot more harder and more these days working from home than they were in office. So we should be able to differentiate this. Is it A, B, C, or D? A lot of people say B. About 90% of people say B, except visual disturbance. Is it right, doctor?
Yes, very, very good. Everyone has been paying attention for the last 10 minutes. Excellent. So B, the visual disturbance is not common in tension headache. If you have visual disturbance like flashing photo, we call it color changes, like disco lights, those kind of visual disturbances are more associated with a migraine type of headaches, not a tension type of headaches.
Awesome, guys.
I'm just going to move on very quickly in the next 3 to 5 minutes about 龙中条.
Oh, yes.
Those of you listening in, we call 龙中条. For those of you who don't understand 龙中条, we call it's a Hokkien phrase for everywhere pain. You pain in the hair, in the shoulder, in the fingernails, in your toes, and everywhere. So everywhere is painful. 龙中条. And this kind of pain, like you could see, this is a real diagram on the left, the A. I always make my patients shape the pain area. Yeah, and I magnify it, and I even give them different colors, which is the most painful. It can be in the mid, what we call the axial pain, as in the midline pain, or it can be the elbows, it can be the thighs, it can be the headaches. So this kind of pain, we have a specific name for it. If you look at the top, fibromyalgia. So this type of pain, 龙中条, fibromyalgia, is not just a simple, oh, you have pain everywhere. No, while you have widespread pain, it actually affects many different things. The other thing is that your sleep quality is very poor. You're always tired. You're always fatigued. You can feel weakness. You can have stiffness of your fingers and joints, swelling. You can have headaches, part of the tension headache. You can have what we call difficulty concentration, cognitive function. You may have an bloating of the stomach, irritable bowel. You can have constipation, diarrhea. You could see that this whole different symptoms that patients feeling, if you kind of match it all in, you might be suffering from fibromyalgia.
Now I am curious, those of you who have heard this fibromyalgia 龙中条, how many of you think that you're possibly suffering from this 龙中条? If you are, just type yes in the chat box while we continue the presentation. Just curious to know.
So when we say what is fibromyalgia, it's a new term. Interestingly, people don't seem to understand what it is. Well, let me educate everyone. So fibromyalgia feels like rheumatism. It feels like Hongsit. What the TCM will say, this is, you got 风湿, you've been showering too much in the night, water have gone into your system, you got too much of rheumatism. Fibromyalgia feels like that, but the mechanism of action is quite different. It is due to nerve sensitivity, due to muscle spasm, micro trauma. So when all these things happen, the muscle is painful, driven by a nerve sensitivity, not nerve compression. There's no slip disc, there's no nerve compression, but nerve sensitivity. And external factors will trigger it, whether it's a lack of sleep, lack of exercise, anxiety, stress, work, husband, girlfriend, boyfriend, whatever. So all these things can affect. And internal problems, hormonal. If you're menopausing, or you're perimenopausal, or mid-cycle, or end-cycle, a lot of these things can trigger fibromyalgia. Previously, 10 years ago, fibromyalgia, even within the medical circle, has been poo-pooed by medical doctors. They say no such things. There's no such thing called fibromyalgia. This is just people with just very low pain tolerance. Not true. We actually understand this very deeply now in a very scientific manner to say that this muscle problem, myositis, we even have a coding for this in our what we call diagnosis code book. Fibromyalgia, when we examine by pain specialists or pain doctors, we will examine the whole body and we will pick up 18 different tender points. If you have more than 11 out of 18, we consider you to be possibly fibromyalgic. As I said, you still have got other things to exclude or to consider. Many different medical conditions mimic fibromyalgia. You will have things like rheumatoid arthritis, not rheumatism, rheumatoid arthritis. You have got connective tissue disorders, even joint arthritis. People always say, "Hey, my joint feels very sung, yeah, but pain comes and goes. One place here, one place there, different days, different place." Fibromyalgia, we know that if you're female and you don't have it, you should buy 40, yeah? Because the chance of you getting it is 10 times to 1. Female to male, 10 is to 1. So if you are male and you got fibromyalgia, you definitely will strike 40, man. So FM, fibromyalgia, we know that there is a genetic basis for it. You're not imagining it. You are not having just because you got low pain tolerance, but why is this so? And how is it affecting your nervous system, making your nerves sensitive, and therefore causing your muscles to go into tension and spasm? We know that there are many stressors that can trigger this fibromyalgia, which is innate in the system. You can have it for many years, then suddenly, boom, it just comes on. Whether it's a road traffic accident, whether it's a serious illness, or whether, some of the ongoing chronic diseases that a patient might have. So if you look at here, fibromyalgia, what are the some features? Widespread pain, sleep disturbance, stiffness, and tightness.
Can you also quickly share with us more about the solutions? It seems like a lot of people are identifying themselves to be possibly suffering from fibromyalgia.
So in 2 minutes, I will go through this. So in terms of treatment of fibromyalgia, depending on who you go and see, people will say, you go and do this surgery, you must do that surgery, or something is pressing. That's not really true. So is surgery actually worsen the fibromyalgia, worsen the pain condition? So no, we don't want patient to go for surgery. Give them medication. Sometimes they say, there's something wrong, or you're depressed, you go and see the psychiatrist. Very often we don't give medications to make the patients so happy to the point that their mood is so good. No, we use similar medications like antidepressants and anticonvulsants to treat the fibromyalgia to stabilize the nerve, to make the nerve less sensitive so that the nerve is able to function properly and the muscles to be in a better state. Very often in the very difficult fibromyalgia whereby they have already done everything they could and they're still suffering, and despite medications, we will give what we call platelet-rich plasma injection, PRP. So you could see the PRP, the yellow thing, as when we take blood from the patient, the red, and then we spin it down, we only want the yellow. We inject this plasma-rich platelet-rich plasma into the injured muscles to heal the muscles, to allow the muscles to recover. So once that's done, boom, finish. The fibromyalgia settles down. And we keep going with certain medications to prevent the nerve sensitivity from flaring up. This PRP, some of you may recognize it. Hey, I actually received it for my face. It's the same PRP that you do for facelift, for anti-aging, for beautifying yourself. It's like a stem cell. Last but not least, some of these minimal invasive procedures we can just now been talking about, we can actually go into the spine to desensitize some of this nerve, make the nerve less sensitive. We don't kill the nerve, we don't paralyze the nerve, we just make it less sensitive. I'm going to end with this last poll the audience question.
Okay, so widespread body pain due to fibromyalgia is the following. A, rheumatism. Is it B, nerve compression? Is it C, muscle spasm due to nerve hypersensitivity, or is it D, arthritis of the bone? So fibromyalgia, in short, we call FM. So you think it's A, B, C, or D? The widespread body pain is due to which part? The 龙重点 is due to which reason? Is it A, B, C, or D? Let us know. Fibromyalgia. In fact, I think through this health seminar and webinar, it seems like we know that there's a new term called fibromyalgia, and possibly a lot of us are suffering from that we have no idea that we are suffering from this 龙重点 until we heard about it. We could all possibly be guilty of it. So I think a lot of them were saying C, muscle spasm due to nerve hypersensitivity. In fact, C is the only unanimous answer here. There's no other answer other than C. So Dr. Lee, the answer is?
Yes, it's C. Well done. Everyone has been paying attention. Yes. So fibromyalgia is a very, very painful condition. Don't underestimate it. It can really affect the patient in a very big way. And this pain is definitely magnified during this COVID period because of lack of exercise, poor sleep, increased stress at home, increased stress from work. I mean, there are so many triggers that can bring on this fibromyalgia to make the pain worse. I'm going to end by saying there's no pain that's so easy to bear than that of someone else, by this famous Lariche. So it is true, whereby it's someone else's pain, you don't really feel it. But when it's your pain, you know how intense and how much it's affecting you. There's always hope inside. We can remove, reduce, and get rid of any pain in the body. Thank you for your attention.
Thank you, Dr. Lee. Yes, when we talk about all this pain, right? So we talk about maybe possibly going for imaging, like CT scan, MRI. We talk about going for all these injections and possibly seeing the doctors and specialists on it. And then you must be thinking, wow, if I go for, all this CT scan and MRI, possibly that will cost me. So that's why I need to bring up this expert. Yes, we have Willie. Yes, Willie is going to also, Willie is from PFP Legacy. Hello, Willie.
Hi. Hi, everybody.
Willie, can you also share with us what PFP Legacy does in short?
Sure. PFP Legacy is established basically to educate people regarding estate planning services. We also do other stuff like lasting power of attorney and also business succession, which I will bring up later on also.
Okay, so, and also, Willie, you do know that just now all these cases that we mentioned, we could also claim some kind of insurance if we were to go to get CT scan or MRI or see doctors, right?
Well, you are not wrong. So long as due to injury or accident itself that causes the pain, all right, like prolonged sitting or lifting of heavy stuff that sprain your back, definitely you can claim under the PA, under the medical reimbursement. So this is something to offload some of your finances liability that you may have.
So for personal accidents, if they have the relevant policies, and they can also claim this if they were to suffer from all these pain injuries as part of the work or during sports or something like that.
Yep. During sports, even going downstairs for a walk or buying of stuff and you just trip and fall or you step on a stone. it can be claimed too.
Or just like what Leeway, one of our members said, Leeway, who said, go out to tapao is also a form of activity. Maybe, you just go tapao and then you trip and fall. Yes, you can also claim your personal accident policy on that. Yeah. Just now we have all three doctors mentioning about the physical pain that we experience while working from home, like the back pain, like the neck and shoulder pain, and also generalized pain like the 龙重点 as well as the headache. All these are physical pain. But what really you're going to share with us now is more about the mental pain, right?
Yeah, it's more on the mental pain and the financial pain that we feel. Slightly different from what the doctor has shared. But to add on to what Dr. Lee has said, during this COVID-19, the stress level definitely went up, especially one area for parents, home-based learning. That's something that I guess most parents are facing.
Are you speaking from experience?
Yes, definitely. With 3 kids at home, it's definitely extra stress than working outside.
Okay. So, another is the mental anguish and the mental pain. So, Willie today is going to share with us more about the pain of intestate. Let's take a look at the presentation.
All right.
So the intestate, this term seems real big, and a lot of people might have this misconception that they think that Oh, intestate has got to do with the intestine. It has nothing to do with the intestine. Okay. So in short, what does intestate means, Willie?
Okay, intestate basically means where someone passed on without writing a will. All right, this is what in term of the legal term of what intestate is all about. So later I'll show you a few more. So okay, so let me share a bit more about PFP Legacy as I mentioned earlier on. We were formally formed in 2016. PFP Legacy Asia was basically conducting of corporate and public education seminars since 2013. So basically our vision is to enable families to protect, accumulate, and also to ensure a smooth transition of their estate to their loved one in the event when they pass away. All right. So we deal with business in terms of will writing, lasting power of attorney, and even business succession. So today's main topic itself is what we call pain of intestate. That's what I mentioned earlier. Intestate is not what some of you may be thinking. Is it pain of my intestine area? Definitely it's not. So when we talk about distribution of assets in real life, basically there's only two ways of how our assets can be distributed when we are no longer around. One is called we die testate, where one dies with a will written, and the other method is where one dies without a will written. That's what we call die due to intestate. Okay, so these are basically the two main areas how our assets can actually be distributed. All right, so today the pain that we are trying to emphasize here is what the pain that will feel when for the loved one when one dies without a will, what is called pain intestate. All right, so the first pain, basically there's four main pain areas that we're looking at today. The first main pain itself is what we call family dispute. So how does not writing a will or having died of intestate create this family dispute? All right. If we can see on articles, there's numerous articles itself. This is one of them you have seen. When one do not legally write down or put down their wishes of how their assets will be distributed during time of death, a family will be going after assets. All right. This is one of the very classic example itself, where a dad passed on their estate, and somehow, somewhere, they discover a stash of cash hidden in the false ceiling. And this is where the family went against them to go and fight for this money itself. And this went up to court and create a lot of family issues. All right. So this is one of the
those families strive because of the unequal distribution of assets and inheritance.
Correct. So once you don't put down your wishes properly, that's where the whole distribution will be unfair because it will follow a very simple law that according to what the law has stated, how the distribution will be given to it. The other concern itself is this, right? We have seen this before. It's a sad case. Family went up on the journey itself on the road trip. All right.
JB.
To JB. This is to JB. Both parents perished. All right. Leaving behind the children. All right. So the concern itself is this: family dispute also come in when we can't enable to find out the next best caretaker, where we call the guardianship itself. Today, I guess when we parents are all around, we always say we're the best parent to our kid. But ask yourself this question: what happens if today both parents are not around? Who will be the next best caretaker for the children or for your children? All right. So this is something that you don't want to be left to court to appoint or let someone to volunteer to do after your children. Even so, not many relatives or family members or even your parents are able to look after your children at the point of time, all right, depending on their age and depending on their finances also, all right? Or for example, most commonly people would say that during a time of crisis, when both parents are not around, well, my brother or my siblings, all right, will be able to look after my children. But let's face it, if today you have 3 kids, for example, I have 3 kids, and if my brother have 3 kids, if I put my brother as the guardian of my children, can you imagine today, if today I don't come back home, and my wife don't come back home, my 3 kids will be put under guardianship to my brother, who already have 3 kids. With my 3 kids going to his house, it will be 6 children running in their home. And if they're staying in the 5-room HDB, it's going to be a very, very packed place to be. All right?
Yeah, so, mental stress.
Yeah, the mental stress is there, definitely. And not forgetting the financial stress also. Having to support 6 children is not easy also. All right. So this is pain number 1 if someone die of intestate. Number 2 itself is where we call what happens if money go on the wrong hand. When one die without a will, okay, all your assets will be distributed according to a law stated by the government, all right, or by the law called the Intestate Succession Act. all right, which money will pay out according to how it's being stipulated. It's not by your wish, but according to the law, all right? And when that happens itself, many things will happen. One of them is what happens if your spouse are unable to handle the kind of finances that's given, all right? We have one classic example here. It's a sad story. It happened in somewhere in 2012, if I'm not wrong. The husband passed away in the budget terminal, all right? So through the insurance, through donation itself, the family managed to, receive up to $1 million, right, on the death of the spouse. But after a year, the spouse literally spent the entire 1 million, all right? Was it her fault? Yes and no, not entirely her fault. The only thing is basically she doesn't have the knowledge and skills, all right, to manage the fund. So once money is being put to someone we have no knowledge of how to handle it, it may end up spending on other stuff, all right? And that doesn't mean it's only happened to spouses. It can be on children also. Can you imagine if today both parents not around, all right, and your kid is the only one that's alive, all right? So under the law, all your money will go to your children. And if your children is age 21, can you imagine today if all of us are age 21 now, and we receive an inheritance of, let's say, maybe 1 million, not too much, let's say 1 million. I'm very sure all of us will be celebrating somewhere at some place, right? If not for the COVID-19, it'll be somewhere maybe opening a champagne, all right?
Yeah.
So this is where not everybody will have the mental capacity itself to really handle the finances when it's given to them, all right?
So
And this is what
financial literacy is very important.
Yes, it is.
Because if you have the lack of financial literacy, even if you're given $1 million, $2 million, or $10 million, you will not be able to manage your finances. And therefore, estate planning is very important. Should you have already done the estate planning, these funds could be placed in some kind of trust, and eventually it can take care of the children's education. In this case of the Straits Times News, we were all very appalled by the fact that $1 million worth of charity donations has poured in, and within 1 year it was all gone because they have no money sense to manage the money.
Yeah, definitely. I mean, it's a shock to everybody also. Right? But what you say is totally true. It doesn't mean what the value is. Even 10 million, it can be spent within a year or so. All right. So proper management is very, very important. Not only just on children as possible, even elderly itself. All right. Even today, if you do not do proper planning, and in the event if you are single, right, almost all your money will be given to your parents also. So can you imagine elderly itself having a lump sum of money given to them at their retiree, at their very old age? They also fall into con men. All right. So this is where we need to ensure that things are being done properly itself, to ensure that money do not goes onto the wrong hand. All right. Maybe your spouse, your children, or even your parents. All right. So pin number 3. All right. It's a lengthy court process. Today, I'm not sure how many people know the actual process when one passed on. This is a very summarized one already that I've managed to summarize from the whole doctrine itself. Okay, when one passed away, so other than getting the death itself, the most important thing is the beneficiary need to be gathered together to volunteer to be the administrator. Where in this case, the administrator is someone who so-called run around, right, from lawyers to insurance to bank, basically to ensure that the assets will be distributed. Okay, so in short, in Chinese, the administrator can be known as a pao tui. Okay, then only when the administrator is being chosen, all right, the other beneficiaries will have to waive their right before this thing can go on, which means there cannot be any dispute with other beneficiaries. If today we have sibling rivalries, for example, and one of them don't like the other person, okay, this thing will just basically unable to confirm who the administrator going to be, and the court will basically ask you all to go back and rethink about it and come back again when it's firm. All right.
Can the beneficiary be administrator in this sense?
Yes. Basically, all administrators have to be beneficiaries when you do not write a will. Yeah. So all your children, your spouses, your siblings will all be called out. All right. To ask who want to be the administrator of this estate. All right. And worse, if you have young children, you need to furnish surety. All right. Surety is like a guarantor to ensure that the minor's assets is being taken care of. All right. And it's not easy to get surety itself. All right. In certain aspect. And the other thing itself is also looking at this. After getting surety, you also need to have this thing called the schedule of assets. Okay, schedule of assets is something that is required whether you have a will or without a will. Okay, the law will ask you, the lawyer whom you filed to get the letter of administration or the grant of probate in the case where you have a will, that you have to furnish this thing called the schedule of assets. Okay, scheduled assets is basically every single thing that you have. So it's something that need to be written down, all right, properly itself, so that in the event when things happen itself, the administrator or the executor itself will be able to get this and do it, file it to the lawyer who will file for the letter of administration. Okay, and this thing will take time. Could you imagine today, when I do a lot of seminars these few days, this few months or years itself, many of the parents, many of the spouses will still say that they do not know what their spouses have. Okay, so this is the very common thing. So it's important to write down what you have itself, so that in the event when things happen, all right, this thing can be given to the lawyer to file for the letter of administration or grant of probate. So this is how the whole process is. And finally itself, when the letter of administration is being given itself, then it will be distributed according to the ISA. Okay. So pin number 4, okay, is basically the expensive of probate. When one die testate, all right, the cost of getting a grant of probate will usually range between 1,500 to 3,000. When one dies without a will or die intestate, the price can go from 3,000 and above. All right. One of the reason, if you ask me why, is because today if one die intestate, okay, you will not know what kind of insurance policy you have, how many bank account you have itself. So the only way you can know, all right, or the loved one will know, is to basically ask the lawyer to send out to all the insurance industry or the financial industry itself to ask whether does this person have any policies or any accounts in this company. And by doing so, all right, it's not free. The lawyer will charge you a cost, and that's why the cost will go so high. And
The process
imagine
of
this,
finding, right? All
yeah,
this
correct.
application process.
And imagine if you have overseas assets, all right, that will even be more costly. That's why for a person who died intestate itself, the cost can render up to 5, 6, or even 10,000 if you have
Wow.
multiple properties overseas,
Overseas.
not just Singapore.
Understand.
Yeah. So how to prevent all this pain from coming to you? All right. The way to prevent all this pain mentally and financial pain itself, well, it's very simple itself. It's basically to start writing a will. All right. Get yourself to give you the privilege of choices. With a will itself, you'll be able to choose your executor. All right. Or as in who will be the one who will run from law firm to the bank to insurance and even to the distribution of the beneficiaries. Okay. Without a will, as I said, you got to find an administrator to do this. And this administrator got to be selected from the pool of beneficiaries, which one of them must volunteer, but the other have to relinquish their rights. So when the will is done also, you can also do testimonial guardianship, which means you ask yourself this, even today as a parent myself, it's hard to choose the next best set of parents to my children. Okay, we always say we are the best parents to our children, but when we are not around, right, I took up 2 weeks to think who is the next best set of parents for my children. If today both me and my wife are not around. So this is very, very crucial itself. Can you imagine if today, if as a parent ourselves, we can't even choose who the next guardian going to be? How would the court or all the other beneficiaries or your relative want to volunteer to be the guardian of your children? So this is very tedious. So with a will itself, you can also ensure that everything that you want, all right, that you choose will be distributed according to your wishes to everybody that you stated down. All right. Without a will, the whole distribution itself will basically follow this thing, what we call the Intestate Succession Act, that's governed by the law. All right. You have no choice of how much and who you want to give. You can't apportion what's the percentage also. Everything is stipulated accordingly. All right, and by doing so, it may fall into the wrong hand, because those who you want to give more will not receive, might not receive more, and those who you do not want to give more may receive more. Okay, so that's what's happening now. And last but not least, itself, with a will itself, we can always do this thing called a testimony trust, a trust that can help you to enable money being wisely spent. Right, whether is it for children, is it for your spouses, or is it even for your parents, right? For example, for children especially, right? In my will itself, I'll make sure that my children will not get a lump sum when they reach 21. Okay, so under a will, we are able to create a testimonial trust in which, for some example itself, you can give them by installment basis on a yearly basis all the way until probably they reach 35 for my case. All right. So when they reach 35, that is where they will receive all the lump sum of what my asset is. Because I guess to me, by age 35, they are mature enough to handle the money. But at age 21, definitely not. All right. So this can be done with a will. And when you don't have a will, this can't be done. Basically, every amount that you have set aside will go to the children or the spouses or the parents in the lump sum amount. All right. And that's where some money will be spent unwisely.
Okay, so we also have during this COVID-19 period of time, the news came out in America that there's, other than a rush, the usual rush to buy groceries and the usual rush to buy toilet paper, there is also a rush to get will done online. And this is like the trending and the buzz thing right now in America. So a lot of people like, oh, this is COVID-19. And they are thinking like, what best to do in the event that should I pass on because of COVID-19, it suddenly hits me, I have not done my will. So actually will writing is one of the buzzword right now in America especially, and then now over as it escalates in Asia, a lot of people are also setting up and getting their will done. So that is why I think today Willie, you shared with us a very, very good thing about how we should set up our will and how it saves time, the difference between setting a will and no will, and the cost involved as well, right?
Yep.
It's very important for the cost for us to know.
Yeah, cost is definitely very important itself. As you can see here, one with a grant of probate itself is much more affordable than the letter of administration, which can range from 1,500 to 3,000 for a will of grant of probate. For letter of administration, it can go up to 6, 7, or even 8,000 itself. And the process is much faster for the grant of probate as compared to letter of administration, as you can see over in my slide here. All right. And also over here, you can also realize with a will, basically you only need one executor, all right, to establish the distribution of assets. Whereas if you have no will and you have a minor, the court will want to assign 2 administrators for the safety of the children. Okay. So all this will take more time and more money from you if you do not start something that is off now. But what you said earlier on is true. The need of a will itself starting to rise up recently itself, partly because people suddenly had a fear of that they may just pass on suddenly and realize that the money will not be distributed according to their wishes. So this is something, a trend that's going on currently. And so our service itself, what PFP Legacy do itself, basically what we do, we provide estate planning services to take into consideration of both social, economic factors, set aside all the stuff to ensure that your legacy is being created. All right. We also provide will writing facilities itself to ensure that your possession will be distributed according to your wishes. All right. And the most importantly is to create this thing called the scheduled assets. We are able to create a one-file system that's easily retrievable itself, so that during time of crisis, the executor, all right, that you nominate to run your will be able to retrieve these scheduled assets and to look for any lawyer and to make the whole transition of getting the grant of probate much smoother than ever. And last but not least itself, we also talk about this thing called the lasting power of attorney, which we will not be sharing today. It's a topic by itself, but it's also as important as a will, because will is the wishes of someone who is no longer around, while lasting power is the wishes of someone who is still around but mentally incapacitated. Okay? So today, to end off my slide itself, we have this promotion that we're going on for the webinar exclusive for a standard will with 12 clause, including a testimony trust. All right, and will custody itself, in order in event you are not sure where can you store your will, and also inclusive of lasting power of attorney under Form 1. The currently webinar exclusive, we are going at $250. Something that is very reasonable itself in the market, and you can look at this as a very basic and yet comprehensive package you can find. All right, to add on further itself, for this everybody who are here today, all right, you can receive additional $100 voucher from us. All you need to do is to text PFP 100 with your address to this number 918-19556, right? And you receive a voucher that's sent to your email. And with this voucher itself, you can offset your $250 and make it just $150 for the entire package.
Wow.
Yeah.
So these are the standard packages prices, but right now only for the webinar exclusive is at $250 only, and you can redeem another $100 to offset this $250. So all in all, it's just $150.
Yes.
So I would suggest that you just take on your mobile phone right now, take a snap pic of this, okay? So that slowly you can have the information about how to text PFP 100, which number to WhatsApp to. Okay, so thank you, Willie, for sharing with us so much about this pain of intestate. Okay, so we're gonna go for a quick 5-minute Q&A panel discussion featuring all our doctors back in again, and also Willie, so that if you guys have any questions, all right, we will have to answer 5 minutes to answer them. In fact, Desmond just came out with a question: having numbness on the right leg due to LBP for 2 to 3 weeks, is it necessary to go for MRI, took painkiller and inflammation pills at the moment? Any doctors want to answer this? Dr. Lee?
Yeah, I guess. Oh.
Mark. Yeah, sorry.
Yeah, I mean, obviously I don't know the patient, and I would probably think that it would be good for him to get a medical consult for sure. But yeah, lower back pain with some numbness and numbness radiating down the lower leg, it certainly sounds like it's a possibility that imaging might be required already. Obviously, you still need to do a good history and clinical examination before making the call. So yeah.
Okay, thank you. I hope it answers your question, Desmond. And the next question is, I was tested positive for anti-nuclear antibody last year, and so far I'm going through half-yearly consultations with a rheumatologist. I'm only asked to take vitamin D supplements at the moment. However, I have been experiencing lower back pains and occasionally knee joint pain, especially so during the rainy season. Do you have any advice for me and how I should manage my pain, doctors? So it's open to all of you. Any doctors?
Notice, or maybe I'll take this one. So when you have a knee pain, for that, was it a lady? Yeah. Well, the patient that mentioned about the knee pain. So whenever we see a patient with knee pain, we always ask ourselves, is this coming from a local problem, or is it coming from a systemic problem? Local means that within the knee itself. So what are the most common knee injuries, trauma, sports problems, degeneration due to wear and tear? So the knee itself, within locally. Or is it coming from systemically, means that it's in the body, generated by the genes or by immune system or something, is causing the knee to get inflammation. Rheumatoid arthritis, connective tissue disorder, SLE, a lot of these kind of weird and wonderful names that most people does not even have heard of. So the rheumatologist that the patient has seen have done a blood test to suggest that there is a possibility of the patient having rheumatoid arthritis, or what we call connective tissue disorder. So this is a different problem from an aging degenerative knee problem. So that in itself, the Zhongyi will call it, the TCM will call it Hongsit, rheumatism. The specialist, the CE, the Western medicine will call it rheumatoid arthritis. Because the blood parameters, the what we call the anti-nuclear antibodies, is positive. So that is a suggestion that the patient has got this rheumatoid arthritis suggestion. What the patient, the viewer did not give more information is that we need ESR and CRP results. Then we can give it a little bit better assessment to say, is this condition active? Or maybe what we call is just, you have the condition, but it's not flaring up. You have this little bit of aches and dull pain, but then it's not going to cause destruction into your knee joint unless it starts to flare. I think that's a lot. I'm not sure whether everyone can actually process all that.
Quite clear, Dr. Lee. Yeah, okay, so last two questions, okay? The next question is probably, yes, for Willie. One of our participants today said that, wow, it's too good to be true. So cheap for both the lasting power attorney as well as real. And probably, is it some kind of the template that's put from the Google? Can you address that?
Okay, it's definitely not a template from Google itself, but it's true. You can download all this Google template and do on your own. But the question is it legally binding, and whether is the content according to what you want? All right. The will that we're doing, even the LP itself, is all done by lawyers. Right, they're all certified lawyers or in-house lawyers that we deal with. Why are we able to offer in such a low price? It's because the volume that we are doing in Legacy itself is tremendous. We write a lot of wills every single month, all right, and we are able to offset the cost. And we want to bring the best to our clients. That's how the whole thing is. So it's definitely not just cut and paste from Google or whatever. Every single will is different.
Yeah, I think if Willie dares to give us something that's from the Google, he would appear on the webinar, and then this broadcast to so many people.
I will just give you the web link. Please go and download this.
Yes, although it says too good to be true, but it's really so because today this is an exclusive for the collaboration together with Singapore Paincare Holdings and PFP Legacy. That's why only for our viewers today on the webinar, you get this exclusive deal. And sometimes when things are too good to be true, you're like, start the question, is this coming from the Google? Okay, we try to give you the best out of the best. Okay, thank you, Willie, for giving us this exclusive privileges for our webinar participants. And our next question is, Yvette has a question. My mom has numbness and burning sensation, both her food base. So what can the doctors suggest? Maybe Jeffrey would like to take the lead to answer this, and maybe the rest can in.
Sure. I think we need to find out the cause of the numbness. So it says both feet. Well, is there any cause to it? I mean, one of the most common that we family physicians think of is diabetes. Whether she has it's a case of diabetes. Is it just a foot, or does she have a hand numbness as well? Because this is very typical of. So normally I would, suggest to do some blood tests and certain other things like less commonly we see, syphilis or things like that can cause. So best to seek a doctor's opinion, because this is a very vague symptom, and then we need to see whether there are any other symptoms that go along with the burning or numbness of both feet. Yeah.
Okay. Thank you, Jeffrey. So I think we have a lot of questions that's coming in. We're just going to flash the contact details. In fact, on this webinar itself, you will have seen the contact details for our doctors as well as our speakers, Willie, because there are people also asking about, can you flash the cost for the IPA and a will again? So we will get back to you. In fact, all of you who have registered with us, who have registered with us today, there's a Google form at the top of our comment section over there. Once you fill in the Google form, we will give you all the inquiry details, like who to contact and the exclusive for this webinar. So we'll email to you so you know who to target. For example, if you want to look for Willie for the will, and where can you contact him, and what is the email address, and how can you get the $100 exclusive voucher? And of course, to Dr. Jeffrey Low and Mark from the Lian Clinic, they have some questions for you, where to locate you guys. And finally, of course, to Dr. Bernard Lee from the Singapore Paincare Center, where can they look for you at the Paragon, or can look for you at the Novena? All this information will be emailed to you guys, okay? But of course, keep your questions coming. We will take some time to answer you right after this webinar ends, okay? But of course, if you think that you have tremendously benefited a lot from the sharing from all our 3 doctors as well as speaker from PFP Legacy, all right? Can you help us also give a thanks to all our speakers via the comment section over here? You can give a thumbs up, you can say thank you, you can give a shout out to all of them. All this are motivation for our doctors and speakers to keep coming back with another round of webinars to address all this pain, because right now, as I mentioned, we are really staring in the face of the unprecedented economic shocks during this COVID-19 period. The things that we think that it's norm is no longer norm. And working from home is perhaps the norm for the next few months. And we always think that we are young and therefore we will not be suffering from all this pain. It is not true, because even I myself have back pain right now, sitting too much at home and all this inactivity and wasting and this use of the muscles. So these are things that we experience. And of course, this is not the only pain generators. There could be more. So we'll be coming back with more series of this webinar brought to you by Singapore Paincare Holdings, okay? And thank you so much for all your encouragement that we see, like Els and Desmond, and we have Shanice and also the Huang Fang, all these people. Thank you for joining us today for our webinar. Do help us to share the news together with all your friends and your relatives. So you could click a share button. That should be on your right, okay? So click the share button and share this webinar together so that they can also learn about pain, not just mental pain, not just about body pain, all this pain that we all experience during this period. Thank you so much to all our panelists once again. Thank you for the great work today. Thank you, Dr. Lee. Thank you, Jeffrey. Thank you, Mark. Thank you, Billy.
Thank you.
Thank you.
Thank you.
Right, thank you. And we'll see you next, I think very, very soon for our next webinar. My name is Charlene on behalf of the Singapore Paincare Holdings as well as PFP Legacy. We'd like to thank you for your presence today. Have a great weekend. Bye-bye.
Bye-bye.
Bye.